Good evening and welcome to the first installation of our 2021 educational series, tonight's webinar on nutrition and orthopedic surgery. I hope everyone has had a great start to the new year. We will get started in a moment, but first, please allow me to take a second to explain tonight's format. In a minute, I'll introduce our speakers. To keep background noise down, all participants other than our speakers have been muted. We ask that you submit any questions via the Zoom chat feature, which you will find in your Zoom toolbar. Questions are encouraged. Feel free to submit your questions at any time, and we will refer to them during the Q&A portion. Now, for a brief introduction of OrthoSouth. We offer comprehensive orthopedic care across 8 clinic locations in the Mid-South region. We have surgery centers in both Germantown and South Haven, Mississippi. And we're proud to let everybody know that our Germantown Surgery Center was recently ranked a Newsweek top ASC in America, #2 actually in all of Tennessee. We offer Saturday clinic hours in Bartlett, evening hours in East Memphis, and welcome walk-ins at all locations. For those after-hour injuries, we have an urgent care line available 24/7 that will connect you with a board-certified orthopedic surgeon ready to assist. And now to introduce our panelists. Dr. Michael Neel has been practicing for more than 24 years with a focus on treatment of adults with hip and knee arthritis. He currently serves as chief for the orthopedic division at St. Jude Children's Research Hospital. Dr. Neel lectures to national and international audiences on the management of skeletally immature patients with bone cancer, the use of oncologic prosthesis in adults with massive bone loss, and the management of osteonecrosis. Alyssa Wilson is a registered and licensed dietitian with a bachelor's degree in exercise science from the University of Georgia and a master's degree in nutrition from Georgia State University. Alyssa currently serves as the director of MealMD, where she helps participants meet their goals through personalized nutrition counseling. Prior to MealMD, Alyssa worked at the Centers for Disease Control and Prevention, developing and providing comprehensive nutrition programs and coaching to CDC employees. Alyssa specializes in weight management, hormone support, and in integrative and functional medicine. So without further ado, we will proceed starting with Dr. Neel and an overview of the role of nutrition and weight management in orthopedic surgery. Take it away, Dr. Neel.
Thank you, Melissa, and thank you for everyone who's participating tonight. I hope you'll ask a lot of questions at the end. Over the past few years in orthopedics, nutrition has become a very hot topic, and we've realized, thanks to the literature reviews, that nutrition plays a big role. And we always kind of thought that it was an issue, but now we really have numbers, we have facts, and we have science to prove that nutrition is a big part of orthopedic surgery. And so why is it important? Well, it's a major component to wound healing. And we make a big incision, you do a total hip or total knee on a patient, it's a big incision, and that incision needs to heal. And it also provides fuel to heal the tissues, the muscles that we cut, and all the work that we do. And nutrition helps to prevent postoperative complications. It's well documented in the literature that the better your nutrition is, the better your results are going to be. And having strong muscles and strong tissues, et cetera, that facilitates the rehabilitation process of any surgery. So it's very important. Next slide. So I'm going to ask questions that I think most people would ask me, and then I'll go ahead and give you the answer. And if you have more questions, obviously at the end. So when is nutrition most likely to be a serious consideration? Well, elective major surgical procedures. Now, what is an elective procedure? Those are surgeries that you choose to have. You haven't fallen and broken your hip or your knee. You have hip arthritis or a condition that requires you to need a major surgical procedure. And typically these are hip and knee replacements, sometimes some spine surgeries, and there's others included in that list of elective surgeries. But a major surgery is one that's, it's a big deal. It has some blood loss to it. It's going to be a big surgery, a lot of tissue removal or cut through, and you need to be nutritionally maximized in order to have the best results you can. And so elective surgeries aren't emergencies. Again, if you fall and break your hip, or if you have a tumor or something like that, that's not considered an elective surgery. But an elective surgery is one that you choose to do, and it's kind of even to get through it. Next. So how do we measure nutritional status? When I ask you, nutrition is important, well, how do I know how you're doing nutritionally? Well, we can do laboratory values such as albumin, which is a blood level that we check. And there's lots of others. I won't bore you with all that. The really important one that we really use is the body mass index, or BMI, which you're probably familiar with. Next. So the body mass index is a value that's derived from dividing the body mass, which is the weight in kilograms, and the height squared. And the ratio is expressed as kilograms per meter squared. Next. And so, as you could see in this slide here, the normal BMI is up to about 30. And then we consider you overweight. I'm embarrassed to say I'm definitely in the next category. Up to about 30, a BMI of 30. Above 30, we consider you obese or even morbidly obese if you're above 40. And so the BMI is an excellent way for us to put a number on where you are nutritionally. And so next slide. So how does that number, how does the BMI measure, which is a certain measure of nutritional status, influence your surgical eligibility? In other words, if you come in and you have terrible looking x-rays and you're miserable and you want a knee replacement or a hip replacement, how does your BMI influence your surgical eligibility to have that surgery? Well, we know from the literature, as I mentioned, that elevated BMI has been shown to influence outcomes, how well you do. And the higher the BMI, you have the higher risk of complications. Next. So for instance, we collect those numbers, and we know that patients, again, from the literature, it's strongly supported by the literature, that the patients with BMI under 40 have no increased risk at all. They do really well. Between 40 and 45, you have a moderate risk of an increase. Between 45 and 50, it becomes moderate to high risk, depending on other things. And a BMI over 50 is an unacceptably high risk for surgery. If you have a trauma, a fall, a broken hip, then we have to do the surgery. But for an elective surgery like a knee or hip replacement, over 50 is just completely unacceptable, and we just won't be able to do the surgery. Next. So when I talk about risk, what are those risks? Well, there's medical risks such as heart attacks, strokes, blood clots, even death. The higher your BMI goes, the higher the chances are that you might have one of those. And then there's the surgical aspect of it, which wound healing can be delayed. You can be up to 2 or 3 weeks instead of the 2 weeks. It can be impaired. You can have a wound dehiscence, which is where the wound basically falls apart. Literally, the two sides of the incision don't heal together, and gradually over time, the wound opens up, and you have to have another surgery. You get a deep infection, and that impedes your rehabilitation and slows the whole result down. And you might have to have multiple surgeries if you have wound problems or wound complications. And overall, it leads to poorer functional results. So from my perspective, if you have a BMI less than 40, you got the green light, assuming that your internist or your primary care doctor has approved you to have surgery. If your BMI is under 40, then we're good to go and we do your surgery. If you're between 40 and 45, it's really the surgeon's choice. The surgery will likely be done if your other nutritional parameters are met, if you're overall a favorable candidate. Sometimes here from between 40 and 45, we would prefer you lose a little weight to get a little closer to 40. But it's really kind of dealer's choice between 40 and 45. Anything between 45 and 50 is, and even above 50 is certainly unlikely to meet the criteria to do your elective surgery. So we really want it below 40. Between 40 and 45 is okay. 45 and 50 is probably not going to make the cut. So diabetes is another very important topic to mention, and another consideration. We know that controlled diabetics have only very small risk maybe equal to the general population, but unfortunately, uncontrolled diabetics are at a much greater risk of the same complications that we just mentioned. So how do we assess diabetic control? We look at a lab value called the hemoglobin A1C. If you're diabetic, I promise you're very familiar with this. Under 7 is considered safe. Again, the green light. 7 to 7.5, it's at the surgeon's discretion. And I would say most surgeons will not operate on you if you're over 7.5. So the important reason we're here is how do we control those two factors that are so very important to surgical outcomes? And that's how do we control the BMI and the A1C? Diet and exercise. You hear it 1,000 times a day. How do you lose weight? Diet and exercise. It's easy, right? No. So diet is easy. But how do you exercise? How do you control the exercise part of it when your knees look like this? When you have bone-on-bone cartilage loss and you got bone spurs and you got a stiff knee and you can't even get in the car, you don't want to walk up the stairs, your knee hurts so bad. The diet part, you're willing to do that, but the exercise part is not an option. So it's all about, for me, and what I've told patients, it's all about input. It's what your nutrition is. It's what your diet. And exercise, while a vital part of weight control without knee arthritis, for my patients and exercise this away. So it's all about what you're putting in. So diet and nutrition are vital in preparing for a successful surgery and making you an eligible candidate. And so to tell you how we got here, I wanted to lose a little weight. I don't have knee or hip arthritis, but I wanted to lose a little weight. I stumbled upon MealMD, and Alyssa and I have been working together, and I've had a very successful course. I've lost about 20 pounds, and I can promise you that I did not change. I didn't go out and start running marathons. All I did was change my diet. And that's when it struck me how important the diet is to getting a BMI that's appropriate for surgery to lower your risk of complications, and in diabetics to lower your A1C. So I'll give you the disclaimer. I'm not a paid spokesman for MealMD, but I'm a believer in the concept. Whether it's MealMD or whatever, it's learning good nutrition. I tell patients all the time, you can't exercise 30 minutes a day, but you can spend 30 minutes a day working on your diet and your nutrition. So thank you.
Great. All right. So thank you for that. I am going to try and share my screen. Let's see. Oops. I think it says I can't share it because another participant is sharing. Let's see. All right, perfect. All right, so hopefully you guys can see my presentation. Thank you, Dr. Neel, and thank you to Ortho South for having me today or tonight. My name's Alyssa Wilson. I'm going to be talking about MealMD, and I'm going to be talking about, how to get to that healthy weight. Okay, so we know that America is facing a health crisis. There's a rise in diabetes and obesity, and metabolic syndrome. 50% of Americans are predicted to be obese by 2030, and today 4 in 10 are obese. The average person weighs 23 pounds more today than in 1980. We have more than 93 million Americans that are obese, and not just the health problems that come with obesity, but obese adults are spending 42% more on direct healthcare costs. And like Dr. Neel mentioned, with diabetes, we have 85 million pre-diabetics. And in the USA today, someone dies from a diabetes-related cause every 10 seconds. And the recent research suggests that 1/3 of people born in 2010 will develop diabetes at some point in their lives. So we really want to get to the bottom of this through nutrition, because you can really make a difference. Also, the standard American diet, which we call the SAD diet. When we look around and see what many people are eating today, it's high in processed carbs. There's a lot of added sugars. We're not getting in as many vegetables, and all of this combined promotes fat storage. So when looking at the current guidelines, are they working? Well, taking a look at this CDC obesity map in 2011, you can see that there are several green states between 20 to 25% obesity. When we look at Tennessee in 2011, Tennessee was 29.2% obese. But now we look at, the 2018, or actually this is the 2019, that 36.5% of people in Tennessee are obese, and we can see only one green state there. So as a nation, we are growing fatter and sicker, and the current recommendations just aren't working. I want to mention that there is a lot of nutrition misinformation out there. And I'm sure that you guys have all heard several different theories when it comes to weight loss. And there's a lot of, misinformation out there. Should I go low fat, or should I count calories, or should I eat less and just exercise more? Maybe I'm just not exercising enough. Or should I go keto? So there's a lot of misinformation out there, and I really want to help clear some things up. And that's where MealMD comes in. When I first, started practicing as a dietitian, I remember, coming out of grad school and speaking with people and always telling them to cut their calories. But what we would see is when people cut calories, and I'm sure many of you have seen this if you've tried before, is that we're not getting the nutrition that we need. So we're cutting calories, we're eating less, and we're exercising more, and we're having the stress of calculating everything, but it's really doing damage to our metabolism, and it's making us crave more and more. And it's not addressing the underlying reason of why we're gaining weight, because we know that all calories are not created equally. The calories from M&Ms are not the same calories as from broccoli. So MealMD is really different. We are addressing the underlying hormonal imbalances that can lead to weight gain, specifically insulin. And so by addressing insulin, we can really get those blood sugar levels down and those insulin levels down to where you can get into fat burning. And we really want to clear up any of that nutrition misinformation. So we don't want to restrict calories. We really want to balance your macronutrients. Our meals are higher in fat. So a lot of times, when you're recommended low fat, well, when they take the fat out of foods, what do they add? They add sugars, they add carbs, they add artificial ingredients and sweeteners and preservatives and things that all can mess with our hormones, specifically insulin. And fat is so important. Our brain is primarily made of fat. Fat keeps us fuller longer. Fat provides fat-soluble nutrients like vitamin D, vitamin A, vitamin E, and vitamin K. And fat helps, our cells heal. When Dr. Neel was talking about making sure we're healing after surgery, anti-inflammatory fats are very important to help our body heal. So our program, we have higher fat, moderate protein, and lower carb. We're really getting rid of any type of processed foods and added sugars, because our whole goal is to get your blood sugar levels down and your insulin levels down, again, to where you can get into fat burning. And the only macronutrient that doesn't stimulate an insulin response is fat. So our carbs in MealMD are coming from colorful garden vegetables, mainly. And we do have a few fruits, some berries in there. But our goal is to be around 50 to 60 grams of carbs per day versus over 250 per day, which is in the standard American diet. Another thing that MealMD incorporates is something called intermittent fasting. And it's a pretty fancy term for just saying going a period of time without eating. And our whole goal to intermittent fast is to let your body have a break from digesting food, again, where we can get blood sugar levels down, insulin levels down, and our body can, repair and heal. And we stick to 3 meals a day and no snacking. And that's really the hardest part for people when they first come in, because, we've all been told before that we need to eat 6 meals a day, we need to eat 3 meals and 3 snacks to really get our metabolism going. But our body just does not work that way. When we're constantly eating, and a lot of the times the snacks, think about it, if you're going to work, they may not be the healthiest snacks out there. We may be grabbing something processed or already packaged. And we just have the stress of constantly having to eat throughout the day and planning these snacks. But when we're constantly eating, our blood sugar is constantly spiking and then dropping. And what happens is we're on that blood sugar roller coaster throughout the day. So having these ups and downs can cause you to crash, and it can cause you to have that, slump in the afternoon, and it can cause you to have more and more sugar cravings. So we really take that out and we're going back to the basics. Just sticking with those 3 meals a day, where your breakfast is, substantial enough to hold you over to lunch. Your lunch is filling enough to hold you over to dinner. You have a satisfying dinner, and then you can sleep and your body can go into repair, and then you go on to the next day. So we do recommend that 12-hour overnight fast, and we recommend no snacking. Our whole goal is to fight insulin resistance. And when it comes to insulin resistance, before we get into that pre-diabetes state or that state of diabetes, many people are insulin resistant. Most Americans are insulin resistant, and we're fighting weight management hormonally, and we're doing this by having that macronutrient ratio of 50% fat, which does not stimulate an insulin response, 30% protein, and 20% carbs. So we're really reducing fat in the liver, we're increasing satiety, and we're increasing compliance, because we are making this so easy for you. We are providing you fresh, ready to eat meals 1 week at a time. And the meals are vacuum sealed, they're sous vide, so they'll last the whole week in the fridge, and they're ready in minutes. And our whole goal is to really wean you off sugars and processed foods. So what's in the box? You have 18 chef-prepared meals. You have breakfast, lunch, and dinner for 6 days a week. We do incorporate 1 practice day a week. It is not a cheat day, but it is a practice day to where we're providing you education and materials to help you learn how to set up your plate and cook meals on your own, to where you learn how to do this on your own, and you don't have to rely on MealMD forever. So you can see here on the screen, that's just an example of what would come in a box. I do have some sample meals here, but you can see them on the screen. You'll see salmon there, a yogurt for breakfast, asparagus, sweet potato, and you can even go online and personalize your menu and make substitutions. But they're all heat and eat. They're ready to eat in minutes. You really only need a microwave for breakfast and lunch, and for dinners, we recommend heating up with boiling water. And they're ready in 6 minutes or less, really. Now, what's really important when it comes to MealMD and our participants is that we use the food as a tool to teach you how to eat healthy, and help you along the way to where you can do this on your own. But our evidence-based education is the most important part. We want you to learn everything and clear up all the confusion. So when you're on the MealMD program, you'll get 6 weeks of education sent straight to your email. And every week we'll be discussing a different topic. So for example, you'll learn about carbs, which carbs that you want to choose, which ones you have the green light and which ones you may want to, limit for right now, and which ones you definitely want to avoid. And same with fats. Fats are not created equally. We are high fat, but we are healthy anti-inflammatory fats like coconut oil and olive oil and nuts and seeds. We're avoiding these very processed inflammatory oils. And then also you'll learn about how to read food labels. You'll receive grocery shopping lists. You'll learn about other things that don't just impact your weight when it comes to food, but things like stress management and poor sleep. Those two things have a huge impact on our weight. So we'll talk about ways to help relieve stress and how to maximize your sleep to where you really can get into fat burning. So you'll receive all these guides on nutrition and lifestyle. You'll be able to work one-on-one with me. I'm able to counsel, look over labs, and you'll have that support and accountability while we teach you how to lose the weight for good and really, have you do this for, where you can do this on your own and not be on a program where you're on a yo-yo diet or you have some type of packaged processed food or you're restricting calories for a certain amount of time, eating, shakes, and then, you gain it right back. This is where we want to teach you how to do this forever. We did have a small trial, and this goes back to what Dr. Neel was saying, in that with our patients on our trial, they were not, we did not have them incorporate an exercise program. So if you're looking to get a surgery and you cannot exercise, that is 100% okay. We are geared toward that. With our trial patients, the average weight loss was 5 pounds in the first week, and then about 2 pounds in the following weeks. And it really just depends on the person. But that was with our trial patients, the average. Within 8 weeks, everybody lost 7% of their body weight. So that ranged from 7 to 32 pounds, which is equal to the diabetes prevention program in less than half the time. And we're using a real food approach. There is no restriction. There's no calorie counting. There's no depriving yourself. You're eating a real food that is fresh and that tastes really good and still seeing results. When you start MealMD, we do have our participants fill out a initial symptom survey that goes over how they're currently feeling as far as digestion issues, energy levels, how's their skin, are they having headaches? We have you fill that out to where we can see a before and after, where you can fill that same survey out once you complete the program. And what we've seen with our participants has been really incredible. We've seen everyone lose weight, and we've seen people come off medications. We've seen people have more energy, their digestion is better, they're sleeping better, they're not crashing. And they're like, one of the most important things that we see is they're not having those sugar cravings where, when we're restricting and we're eating, our foods with artificial sweeteners, or we're on that blood sugar roller coaster constantly snacking throughout the day, that can lead to a lot of sugar cravings. But by cutting out any added sugars, fueling our bodies with real food carbohydrates and healthy fats and protein, it really keeps our blood sugar stable throughout the day to where we're not on that blood sugar roller coaster. So if you'd like more information, you can always visit mealmd.net. And I guess Dr. Neel and I are open to any questions that you may have.
Thank you, Alyssa. That was very informative, super educational. And yeah, right now we will just open the floor for a few minutes to any questions folks might have. I do have one for Alyssa. Can you tell me about the foundation of MealMD? Is it a local company, and give a little background?
Yes. I forgot to mention this. So MealMD was created by Dr. West, who started the West Clinic, and his son-in-law, Elliot Morris. They started this company really seeing how powerful food can be when it comes to weight loss and weight management and just feeling your best. So when I say feeling your best, getting rid of those added sugars, getting rid of, any aches and pains that can be a sign of inflammation. So when we think about like inflammation, even from food, it may not just be, that we experience weight gain. We may be feeling, joint pain or just aches over our body or headaches. And so Dr. West and Elliot started this company and really saw like how much food can impact our lives. And really, I think it was started off of almost like a Whole30 program where they saw, really great results. And just looking back into the guidelines that, were given, the nutrition guidelines that were given, and they're just not right. They're promoting, really high carb. Some of the fats that they're promoting are pretty inflammatory. And, when we look at even those CDC maps, that it's just not working. Just the traditional nutrition recommendations aren't working. So really when they started this program and they did the trial, and we've been seeing wonderful results with our participants. And so we are a new company. So this is kind of at the beginning of it. And so, yeah, that's Dr. West and Elliot started this program.
Excellent, thank you. We do have another question. You said that not all calories are the same. Could you tell us a little bit more about that?
Yeah, so not all calories are created equally. And, working with thousands of clients, I've seen, even people log their calories, they're restricting, they're eating 1,200 calories a day, and they'll log it. And, some of these calories come from low fat, packaged 100-calorie foods, but they're not seeing results. It actually can backfire because, when you're eating something that is heavily processed or with added sugars, or lots of preservatives, your body is not breaking it down the same way. You'll see an insulin response. You can see some inflammation going on, eating something processed versus eating like broccoli or carrots that you see on the screen here. We also don't digest calories the same. We call it the thermic effect of food. So, your body burns more calories breaking down proteins than it does, carbs. So there's so many things that come into effect when we, count calories. And also, when we think about the food labels, even the calories, they can be off by 20%. So there's no way that we can actually really count a calorie and measure everything we eat. We don't recommend doing that at all. It does not work. But your body is going to be able to stabilize your hormones when you're eating, what we call like a really balanced meal that combines a protein, a healthy fat, and a carb. It keeps you fuller, it stabilizes your blood sugar, and it fills you with nutrients, versus eating something that may be low calorie, but that's super processed where your blood sugar spikes, then it drops and you're hungry right afterwards. So we definitely are going for the quality of food and pairing foods together that help stabilize your hormones versus just eating something that looks low calorie or it's marketed really well that looks healthy, but it's full of very processed ingredients.
Thank you, Alyssa. Dr. Neel, a question for you. Let's say you have a patient who needs to, I believe I need to probably unmute you. Say you have a patient who, there you go, who does need to lose a little weight before you feel you're comfortable with their BMI and where they are ahead of surgery. What kind of guidance are they typically going to be able to get from their surgeon or from their orthopedic office? Is there any guidance that you can give, or you just have to like pass them off to a nutritionist or someone like Alyssa?
A year ago, I'd tell them it's all about input and just, monitor your nutrition and get online and look around and see what you can do. Now I refer them to MealMD or someone like MealMD, that an organization that focuses on everything that Alyssa was just talking about, that again, it's all about input. It's about good fats, good carbs, all that stuff. And I tell them that they can do it if they focus 30 minutes a day. The 30 minutes a day that they also, I would walk 30 minutes a day if I could, but my knee hurts. I tell them, spend that 30 minutes a day learning how to shop better, eat better, and, just working on nutrition. And that, I think surgeons and patients are looking for options like MealMD.
And there's a lot of, I am all for, physicians giving out nutrition information, but sometimes it can be confusing because, there's so much out there. So we really make it so easy for you, especially with our convenience of having the meals already prepared for you. You don't have to worry about grocery shopping or meal planning or just the stress of getting together your food. It's all right there and ready for you.
Well, I would agree, Alyssa. My assistant who works with me, she hears me tout sing praises for MealMD because I can bring the breakfast, I can bring the lunch, and it's done. Whether it's to surgery or to the clinic or whatever. But it really is. It's all about what you're putting in.
Excellent. One more question for Alyssa is where do you locally source the food? Where does the food come from for MealMD?
Yes, so we do locally source the food, and our food is fresh. We have a kitchen here that is in the Alyssa Wilson Culinary Institute, and so we're making the food each week for you, and we deliver it in the Memphis area. So you'll get your whole week's worth of food. You can see this box here. You'll get this box that will have all of your meals in it, but we are really working on, getting everything like within Memphis, and that's where we're sourcing our food.
Excellent. I have one more question here. I think this is also for Alyssa. When do you exercise in relation to eating a lower carb diet if you typically need carbs for energy during a workout?
Yes, so this is all going to be individual, based on the person, but when we have people on our program, we have people that are like marathon runners and CrossFitters, and then we have people that are, just the casual exercise, that do casual exercise. So it really just depends on the person. That's what we do with MealMD, is that we work one-on-one with them. A lot of people enjoy working out in a fasted state in the morning, and then they can replenish afterwards with breakfast. And then we do have some people where, if they're working out in the afternoon and they've had a busy day at work and they need something around the time of their workout, if they do need more carbs, we work with them one-on-one to specify like how to get a good protein to carb ratio, either like as a meal, they can have their meal and then work out like an hour or two later. Or if they need like a snack, maybe 30, 45 minutes beforehand, we'll have that. We talk about something that works for them. So we do have, that's how it is so individualized. If someone is really, training, then we may add a little bit more carbs in. But the whole goal is to, use real food carbs and use that strategically to where they can use that as their fuel during their exercise, or replenish those glycogen stores after they exercise. But it really is, it all depends on the person. So it depends what they're currently doing.
Excellent. Okay. I will give everybody just a minute in case there are any other final questions. I think we've reached the end of our questions here, but I'll open it up to Dr. Neel. Do you have any, or let's start with Alyssa. Alyssa, do you have any parting words? And where can we find you if somebody has questions or wants to follow up? How do they get in touch with you?
Yes, so you can find us at mealmd.net. And there's a lot of information on there. You can actually go to that website, which we're currently redoing, so we'll have an updated website in just a few weeks. But if you still go on now, you'll be able to see our current menu. So we rotate through different menus, so you'll be able to see if you signed up now, what you would be able to choose from and what you would be able to get. So at mealmd.net, there is, a contact information. You can always email me. My email's awilson@mealmd.net. If you have any questions, our phone number is on the website. So the website is a great place to contact us.
Perfect. And Dr. Neel, why should I come see you? And how do I reach you?
Well, because I'll take good care of you. Me and my team will be glad to take care of all your orthopedic needs. And you get on the Ortho South website and make an appointment. We'll be glad to see you, and we'll take good care of you.
Excellent. Just a reminder for everybody here, the webinar is being recorded. We will post it to our social media channels. It will also be available on our website under the news section within the next couple of days. We appreciate your time and participation. And you can find OrthoSouth at orthosouth.org or call us at 901-641-3000. Thank you, Alyssa. Thank you, Dr. Neel, and everyone. Have a great evening.
Thank you, everybody, for being here.
Yes, thank you for having me. Thanks a lot.